Welcome to the Hizentra Prefilled Syringe training session. Today we will guide you through the process of optimizing infusion therapy using the KORU Calculator and understanding the flow rate differences with Hizentra Prefilled Syringe. Hizentra patients transitioning from vials to 50 ml prefilled syringes, or PFS, may notice a change in their infusion times and flow rates due to different syringe properties. This is not caused by the Freedom infusion system or its ancillary supplies. Let us begin. In our first example, we will look at using the Freedom 60 pump with a 50 ml Hizentra prefilled syringe. To do this, open a KORU Calculator and choose which version matches where you are. For this example, we'll be using the US version. First, choose the Freedom 60 pump and Hizentra 50 ml prefilled syringe option that matches your patient's diagnosis. Enter the dose and select the necessary supplies to meet either the initial or maintenance flow rates aligning with the patient's therapy goals and drug manufacturer's recommended infusion parameters. Once you're satisfied with your selections, note the patient infusion parameters at the bottom of the calculator. Remember, if the total dose is in exact 50 ml increments, or the patient will be using a combination of BD or Medline syringes and prefilled syringes, the calculated infusion time will appear longer due to variance in flow rates between PFS and other syringes. Step 2 will help us fine-tune this time. For step 2, we will show you how to find the total infusion time for a 70 ml Hizentra PFS dose using a combination of 50 ml prefilled syringe and the remaining 20 ml in either a BD or Medline syringe. For this example, we will recommend opening a second KORU calculator so you can easily see your infusion times. On the first calculator, select Hizentra 50 ml prefilled syringe based on the selected needle and tubing combination. Note the average infusion time. Then, on the second tab, input the remaining 20 ml dose that will be transferred into a BD or Medline syringe as a non-PFS infusion and using the same ancillary supplies. As you can see, the total flow rate and flow rate per site is higher than it was for the Hizentra PFS. Make sure this increased flow rate is still in alignment with your patient's therapy goals and the drug manufacturer's recommended infusion parameters. Finally, combine both infusion times to calculate the total duration of your infusion therapy. And that's it. By following these steps, you can ensure a smooth transition for your patients to Hizentra PFS and maintain their therapy goals effectively. If you have any further questions, please reach out to the medical affairs team at nursing@korumedical.com. Thank you for your commitment to patient care.